wash my hands. I'm Sarah. I'm going to be your nurse today. Quick QSIN. We have 2 IVs, 1 in each anacube, both saline locked. Physician's name and staff, date is correct up on the whiteboard. Wristband is correct. Appropriate name, appropriate birth. Matches the patient. There's no clutter in any walkway. The restroom is here. It's open. There's also a commode in the corner. Water pitcher over here. No oxygen, no trach, no abdominal wounds, no catheter, and no drains. Bed is in the lowest position. There are 3 side rails up. The daughter is in the room. Okay. No assistive devices are needed for this patient, and the call light is within reach. So, Miss Blossom, I am Sarah. I'm going to be your nurse today. It's nice to meet you, Cindy. You're her daughter, okay? So I'm going to wash my hands. We're going to go ahead and get some vital signs and see what's going on. From what I see here, you're down in the emergency room today earlier, and they found out that your mom has AFib, correct? Okay. And then they gave her some medication to get her back into a normal sinus rhythm. Okay, so up here we have around telemetry, which is watching her heart rate at all times. And we're going to go ahead and see what's going on. You think she's acting a little bit funny now? Okay. All right, so I have my vital sign machine here. Let's get some vitals under your tongue. Oh, having a hard time opening your mouth. Okay, let's go ahead. Let me see this. Okay, we'll keep your blood pressure on. Can you smile for me? Okay, left side facial droop a little bit. Okay, let's take this blood pressure cuff off. Okay, now can you touch my hands with your arms like this? Okay, 1, 2, 3. Oh, keep them up for a little bit longer. Okay. All right, so I think what I'm going to do is I'm going to call my charge nurse. I'm going to go ahead and call a code for a stroke, because I think that that's what we're experiencing here. And we'll get the healthcare provider in here as well, okay? So we called the stroke team in, have the an EKG here in case we need it. We have suction over here now as well. The neurologist is here. He's assessing the patient. He arrived within 7 minutes, which is outstanding. That reduces our likelihood of like severe damage. He rated Miss Blossom's stroke score at 32. He ordered a STAT CT scan of the brain. So Miss Blossom went and she came back. There's no brain bleed. There's no bleeding on the brain in that CAT scan. So what it's called likely is an ischemic stroke, where there's a clot stuck somewhere which is blocking the blood flow. So we're going to go ahead and provide oral suction right now. So wash my hands, put gloves on, get the suction out. Going to turn suction on, each side of the cheek, around and down on the tongue, up on top, so she's not choking on any saliva. Turn off the suction, put it back in its container, take my gloves off, wash my hands. I'm going to assume that the physician will order some kind of thrombolytic agent, which is a clot buster, basically. So let's go ahead and see what he's ordered. Okay, and now you haven't had there's been no surgery in the past 10 days, no GI bleed or brain bleed in the past 3 months, and then no unusually high hypertension or high blood pressure. Okay, good. So, looks like he's ordered TPA, and that is, like I said, it's a thrombolytic, so it goes in and kind of tries to break up that clot so we get some blood flow to where it's being blocked at, okay? I'll be in here after I administer it, so I'm going to be charting every 15 minutes, doing neuro checks, checking for any excessive bleeding anywhere else for that first hour, okay? All right, so it's going to be 66 milligrams over that hour, which is based off of her body weight. It's going to be IV piggyback and the right anacube. So what we're going to do, we're going to go ahead and clean off the port for the hub. Okay, make sure it's patent. We're going to flush that. Now we have normal saline running also from the charge nurse. And I'm going to go ahead and grab my medication here. We're going to spike our medication bag. Be sure there's no air in the lines. Prime the tubing without losing any medication. I'm going to hang it and attach it. Program the pump for 66 milligrams, which is X amount of milliliters over 1 hour. I'm going to be standing in here, charting every 15 minutes, doing neuro assessment, and checking for any signs and symptoms of worsening bleeding or brain bleeding. Okay. After 2 hours now, there's been signs of improvement with Miss Blossom. She's able to speak more clearly, although there is a little bit of a slur still. Her stroke score has gone down to a 6 now. A little weak on the left side, but able to hold your arms up, which is perfect. Just what we like to see. And Miss Blossom, you and your daughter were wondering what happened. Okay, so with AFib, it's where your atria, so that part in your heart, doesn't pump like it should. So instead of it squeezing like this, it kind of sits here and quivers. And whenever it does that, it's not pumping the old blood out so new blood can come in. And what happens whenever that blood sits, it pools and it gets sticky. And those sticky parts together make a clot. And whenever we had that calcium channel blocker downstairs that helped correct your AFib and put you back into a normal heart rhythm, then everything starts contracting again, and that therefore pushes the old blood out, brings new blood back in, so everything starts circulating again. And once that clot found a spot it wouldn't fit through anymore in your brain, it then blocked the blood flow from continuing through, which is what we call an ischemic stroke. So that thrombolytic agent, TPA, helps destroy that clot basically, so then we have nice blood flow to the rest of the body, to the rest of the brain, okay? Make sense? All right, so it seems like here 2 days have elapsed now. You're going to be getting discharged. So some teaching points we'll go over. Looks like here you're going home on anticoagulant, aspirin, as well as aspirin And what's the third one? Oh, your calcium channel blocker. Okay. Never ever ever skip any of your blood thinners, anything that helps thin that blood or makes it so those platelets, those blood platelets, the sticky things stick together. So never miss your medication. If you do, give your doctor a call. They'll be able to tell you what they want you to do specifically, okay? Signs of the stroke, facial droop, so think fast. Facial droop, arms, so your arms not being able to be up at the same level for the same amount of time. FAS, speech, if your speech is slurred or altered in any way, or it's slow. And then T, time. Very timely matter here. The faster you get treated, the more likely we have some manageable results that are more beneficial, okay? So Michelle's going to take over for me. Michelle, this is Miss Blossom. She's 57 years old. Came in a couple days ago in the emergency room with new AFib diagnosis. They had her treated downstairs with calcium channel blocker. Came into normal sinus rhythm. Came up here on telly. I came in, started doing my initial assessment, and the daughter, who's in the room, super nice, noticed that something was off. So we went ahead, started doing quick stroke assessment, figured out that was what was going on. Stroke team came in, had a CAT scan, negative for any brain bleed, so we went ahead and ordered some TPA, administered that, tolerated it well, responded in the next 2 hours, and she's been improving ever since. Her stroke score is now a 6, and there's been continual improvement. No allergies to medications, which I did ask, which I forgot to ask, but I am asking now, if I could go back in time. No allergies to medications before administering any medications. We checked the 2 patient identifiers, wristband, asked the daughter since the mother was having issues. Yeah. Okay. Do you have any questions for me, Michelle? Okay. All right. Well, you guys have a good day, and hopefully you get to feeling better, okay? All right. Wash my hand.